So we're going to talk about the humeral coaptation splint, which is used often on people who have a humeral head fracture, but no lower arm involvement. So most of the time, you'll start on the inside of the armpit pretty high. You want to have just a finger or two, or an inch or two space between the armpit and where the splint starts. And it's going to come down around that surface of the arm, wrap the elbow here, and then continue all the way up the shoulder to like the mid-scapular area. And that's where it's going to stop. Most of the time, if you're applying a splint on a patient with a humeral coaptation, you're going to want them to have a gown on with their arm out of the gown. It does make it very hard for them to get dressed later on, but to be able to start with nothing on is the best. For training purposes, our patient is going to leave their t-shirt on, and we're just going to talk about padding and measuring. For a humeral coaptation, there really isn't a way to put stockinette on the arm and allow it to protect all the skin. So we're just going to do an intricate layer of padding in a few different areas in order to protect the skin the best we can. We want to make sure, special considerations, that the patient's shoulder is nice and relaxed. We have a natural tendency to self-splint, bringing our shoulder up to our ear. But for this splint to be effective, we need to make sure that both shoulders are even and the patient is in a relaxed position with the elbow at a 90-degree angle. So when we go ahead and measure, we'll start underneath the arm, like just where we talked about, up high, nice, close and tucked into the armpit. And then we're going to bring this measuring material down, around, and to the mid-scapular area. So once we've got this measured, we can go ahead and cut our splinting material, and then we're going to work on padding. For the upper arm and humerus, we'll use a little bit more narrow padding. So this is a 3-inch web reel. We're still going to do our 3 layers to the best of our ability. And this would be generally directly against the skin instead of over a t-shirt. But again, this is for training purposes. So we're still preventing wrinkling as much as we can, keeping that elbow at a 90-degree angle. I'm going to pan out just a little bit. And then we do want to get some little bit of lower arm padding because this humeral coaptation is going to hold the arm at a 90-degree angle, which means we are going to have some contact with the splint down on this lower arm. We need to make sure that we get our 3 layers at least over the elbow. And then wherever the site of injury is, you may want to consider adding an extra few layers there just to give this patient plenty of protection since we're not using the stockinette as well. So we're going to use nice small pieces to finish our padding around to the elbow, making sure to get those 3 layers in while keeping the elbow at that 90 degrees. Okay, so once you have 3 layers on the elbow, we will need to pad up and around the shoulder to where the splint ends. So one of the most effective ways to do that is to use a bit wider web reel. You're going to lay it flat, overlapping slightly with the web reel on the humeral area, and you're going to pull somewhat taut and fan it over the back before you start tearing. We're going to do this several times. Overlap slightly with itself, and then we're just going to kind of tear that off so we've got plenty of padding in the back. It's a bit harder to get 3 consistent layers back here, but the point is just to protect the patient's skin. Some movement does happen with this splint in the back because it doesn't get secured to anything. So we just want to keep the patient's skin integrity in mind as much as we possibly can. And again, this would generally be onto bare skin. So you'll be able to have a little bit more contrast and see what you're doing very well when you have a patient who is wearing a gown where you could slip that arm out. Okay, so we've smoothed most of the wrinkles. Our padding came back from here to down low here, so we've got plenty of padding over the scapula. Our splint is cut, so now we can go ahead and start our application. We'll roll the ends of this splint in, same as before. Making sure that we're not going to give that patient any fiberglass splinters. The size of the orthoglass you pick will vary based on the size of the patient. For training purposes, we are using 3-inch today. For a patient of this size, generally we'd probably opt actually for a 4-inch, but it does just depend on the size of the patient. We're going to tuck that nice and high into the armpit, come around and capture the elbow, still at that 90-degree angle. And then, sorry, I'm going to pull this down just a little bit actually. We're going to wrap this over the shoulder and onto the top of the scapula. When this hardens, it's going to hold them both at that 90-degree angle and keep their shoulder from rising or moving around too much, which is why it's so important that we make sure the shoulder begins in a relaxed position. This is a good splint to get wet on patients who can't tolerate sitting up or sitting still for a very long period of time, because it will speed up that curing process. But for this particular patient, he is able to sit in one place. So we'll go ahead and just hold this, smoothing out the corners, making sure that our elbow, the material is flush with the elbow here. We don't want too much overlapping for when we go to secure it. While that dries, we can start securing down low. We've got our bias. Kind of just wrap that underneath to keep this splint material in place. We'll come down and capture the elbow, a little bit of that forearm. Coming back down and around. But as we rise toward the top of the arm, it does get harder and harder to secure this back area. We'll do one more overlap here. So once we get toward the top of the arm, we want to get as much coverage as we can, but then this is about where we can end for a bias wrap. Once in a while, a physician will ask that a little bit of bias or even an ace wrap be wrapped around the patient's midsection to capture this back piece of the splint. So we'll come around here, grab that end of the splint, and then around the rest of the patient's body. But for today, we're just going to end this bias and tape it here. And then education for the patient is very important on not moving too much, picking at this bias, or allowing it to loosen from the shoulder here. Once we see where our splint has ended, we can go ahead and roll back a little bit of that excess web roll so it's not rubbing against the neck. And then fold up as needed in the back. This is where we may secure with just a little bit of tape, just the splinting material to the web roll so that it doesn't go anywhere, but we don't need to tape to the patient's skin.